So you've been diagnosed with a threatened miscarriage. Here's what you need to know and a bit of what you might like to know. In the emergency room, we often can't tell which way the pregnancy is going to go. To do that, you need to follow up with your family doctor or your obstetrician to schedule some more tests. Those tests include a blood test for the pregnancy hormone called the beta-HCG, as well as an ultrasound. We look to see if that beta-HCG is going up or going down, and that helps us to determine which way the pregnancy is going to go. So do make sure you schedule an appointment with your obstetrician or family doctor, hopefully within a week if possible, to get those tests, and that will help you know which way things are going to go. In the meantime, don't do any heavy exercising, avoid sexual intercourse. We don't know if these things actually help in maintaining a pregnancy, but there's no harm in trying, so we do still recommend those. Now, if you do lose the pregnancy, you should be aware that 1 in 5 pregnancies ends in miscarriage. That's 20% of pregnancies. Many couples don't know this going in and feel very upset, not surprisingly, when this happens to them, but it is actually quite normal for 20% of pregnancies to end in miscarriage. Just because you have problems on this pregnancy doesn't mean that you will not have a successful pregnancy the next time if this pregnancy does not continue. In fact, the vast majority of women do have a successful pregnancy after a miscarriage. You can even start trying again to get pregnant right away if you like. It used to be the World Health Association said that you had to wait a few months, but more recent data suggests that you can try again right away. There's no harm in doing that if you're mentally ready. Of course, it's quite stressful trying to get pregnant, and only do it if you're mentally ready to do so. Allow yourself some time to grieve the loss of this pregnancy if the pregnancy doesn't continue. Reasons to return to the emergency room is if you're having severe pain, particularly on one side of your lower abdomen or the other. That would be a reason to return. If you have ongoing heavy bleeding with clots that's resulting in you feeling a bit lightheaded, like when you stood up too quickly, you feel a bit lightheaded. Or if you develop a fever, that's 38.0 in Celsius or 100.4 in Fahrenheit. Those are 3 reasons you need to come back to the emergency room. Otherwise, do follow up with your family doctor or your obstetrician to get further testing. I'm Dr. Atzema, and those are my discharge instructions for a threatened miscarriage.